webinar today. Today we have the California Community Health Worker and Promotora Asthma Program Spotlight webinar, and it is the last webinar of our 6-webinar series this year in 2019 with the Asthma Management Academy. My name is Arden Caffrey, and I'm with Esperanza Community Housing in South Los Angeles, and I'll be moderating today's webinar. We have a couple of logistics before we begin the webinar. Everyone who joins the webinar is going to be muted when you start. If you have any comments or questions, please put them in the chat box and put to all participants. Sometimes we miss questions or comments if they're sent specifically to a presenter, so please put to all participants. The webinar is recorded, so you can watch it again in the future if you wish. The link for the recording is included at the end of the webinar. All of the webinars from this series have been recorded, so you can go to that same link and find all the different webinars. At the end of each webinar, there's an evaluation, and it opens in a separate window when you close the WebEx window. So please take a minute and fill out that survey. We do hope that we can continue to make these webinars better, and if we continue with the webinars, all of your evaluations and your comments are greatly appreciated. So our 6-part webinar series was developed from the Asthma Management Academy, which is a professional development opportunity started in 2016 by the California Department of Public Health, Esperanza Community Housing, and Comite Civico Del Valle. The Management Academy was developed for community health workers and health educators to support them in educating their asthmatic clients on self-management and prevention. So our topic today is we are going to have a spotlight for our different community health worker and Promotora asthma program models. We've had a lot of questions in the past about how the programs are set up. So we're just going to do a general overview of 3 different types of programs. We're going to hear from St. John's Well Child and Family Center, which is a clinic located in South Los Angeles. Comite Civico Del Valle, which is a community-based organization, and then Inland Empire, which is a health plan, all 3 of which have different community health worker programs, so we'll hear the differences between each. Ashley, next slide, please. So we also have an Asthma Management Academy Facebook page. So look us up on Facebook. There's always information and new things being published. So check us out on Facebook, please. Next slide, Ashley. So we're going to start with St. John's, but since we're having a little bit of trouble getting them on, we're going to skip their part for now. And then, so actually we skip ahead just a couple slides. One more. And we're going to start with Comite. So Esther, welcome. Well, I apologize. Someone says I'm speaking too fast. Esther, welcome. And Comite is in Imperial Valley. It's a community-based organization that was founded in 1987 to improve the lives of disadvantaged communities through civic education, outreach, research, citizen science, and crowdsourcing. So welcome. Esther, are you still on?
Hello.
Hi.
Hi. Esther and Luis. Are you there?
Yes, we're here. Can you hear us?
Yes, perfect. Arden has just introduced Comite, so the stage is yours.
Okay, thank you. I accidentally pressed the hung up button on our phone, so if the audio isn't clear enough, let us know. We'll call back in. This is Luis Olmedo. I'm the Executive Director of Comite Civico Del Valle. Some of the work that we do is around health, research, advocacy, environmental justice. One of the areas that have been an important focus for us as a result of our advocacy work as well is asthma. And part of the reason is that in the area that we live, which is on the U.S.-Mexico border region of California to the east, known as Imperial Valley or the Salton Sea region or the Coachella Valley, this entire region has had challenges in meeting air quality standards. In other words, meeting the Federal Clean Air Act. As a result of that, and the many triggers that exist here, including living next to a large metropolitan city in Mexico, being neighbors, and their form of applying and enforcing laws being a little bit different, has created a burden on us, on the population here, and therefore we have had a large focus around air quality, air monitoring, policy around air quality, as well as research. But that's a little bit about Comite Civico. We're also known, and very important, known as an environmental justice organization. With that, I know that you teed it off with some questions, and I wanted to go back to those questions. Can you put on the next slide? Now I'm going to pass it on to Esther.
Hello, my name is Esther Bejarano with Comite Civico Del Valle. I am a community health educator. I'm not seeing my slides here, so I'm going to be talking some of the questions that we have in front of you, which is partnerships, referrals, organizations, and client numbers. Just quickly, Arden, is this a couple of slides? You weren't able to upload slides for CCV?
I was not. I received them a little bit late to be able to put them on. But these cover the same questions that we talked about.
Okay. I'll to your question about partnerships, Comite has had a very strong emphasis on building partnerships. Over the years, we have worked with the State Department of Public Health, Environmental Health Investigations Branch, and developing research. That has given us a very strong evidence and data to be able to also bring in and build local partnerships. One of the partnerships that we built here locally has been with the local healthcare district in the Calexico, which is pretty much ground zero when it comes to having the impacts of the air pollution, and also has a large number of asthma patients. So currently, right now, we partner with Heffernan Memorial Healthcare District. One of their missions is to provide healthcare through both a hospital or clinical setting. This is a fairly new partnership. They have been around for a very, very long time, like over half a century, and so we're very pleased to be able to come together with them. The program that we brought to them, actually it was their invitation, but the program that we brought to them was part of another initiative or research study we called Respira Sano, which was funded through the PCORI funding request for proposals. At that time, we were able to develop a local intervention. Aside from that, we also were able to bring them an air notification program. So we coupled these two together, and the Heffernan Memorial Healthcare District was very welcoming of this program. One of the values of this partnership is because their focus, and we wanted to focus on this program because their focus is the population of Calexico. Again, Calexico, California is ground zero, getting the impacts from Mexico, getting all the impacts from the rest of the Imperial Valley, which is in California, and so far we have been able to see, just in this last year, I think over 100 home visits just in this last year alone. So you want to add more to referrals?
Yes, and so some of the ways that we do receive referrals are with either community outreach, either at health fairs, at events, at settings where community gathers. It also depends on the program and the objectives of the program, but for referrals right now, we are partnered with a few clinics in Imperial County. One of them is the Calexico Wellness Clinic, and so they are referring patients over to us on a weekly basis, either by checking in with them, dropping by, or they would send a fax over to us of that patient that needs the enhanced care, the home visitation programs that we offer here at CCV. I'm going to just walk you a little bit over the slide that you cannot see in front of you, but I want to just talk a little bit about the asthma education role, the community's role with the patient. And so the asthma education community health worker helps patients at the homes. When we do receive that referral, we help the family identify asthma triggers at the home. Definitely working primarily also with their social determinants of health. Luis was just sharing about a community in Calexico that is one of the communities that is right adjacent to the border. And so that is a very high area of pollution and concern and asthma prevalence. And so we work immediately not only with the triggers at the home, where is their environment, where do they live, and really capturing that. We also help the family with finding out what's in the home. You know, do they have allergens? Do they have irritants? And working very, very closely with the clinician and finding out, well, do they have their allergy test? Are we have an updated asthma action plan where we can come in as community health educators and really guide them with their self-management process? Connecting patients, definitely always connecting them back. We make sure that they know that we are not, doctors. We are non-licensed educators, and really sending them back, making sure that they reach back even though they feel well, and always following up with their clinician. Some of the things that we have been receiving with some of the programs I mentioned, we have several asthma interventions happening sometimes at the same time, is receiving the allergy lab test result. Have they had a spirometry lately? Again, reviewing their plan of action, and families here locally, I'm going to say 5% even know what an action plan is. And so really working with them and broadening their chronic condition that they have and really understanding it. We really focus on them understanding what is a long-term controller, what is the short-term controller. We also work on medication teachbacks. What does that look like? That we're at a home and might be visit number 2, and we sit down with the client after we made our first visit with an environmental home assessment and observation of triggers in the home. And then this is the time when we really talk to the patient and find out, let me see your medications. Let's work on what you have. We might have something that's expired. We might find medication from the ER that was given to the patient, then when they went to one clinic and then the next. And so really helping that patient and guiding them to their success. We also, I mentioned quickly, identify patients, the strategies to prevent asthma symptoms, for them to know their triggers. What is a trigger? What are the early warning signs that they have if this is, we are educating a child, and making sure that they know that. Again, making sure that they have a safe sleeping environment. That would, for me, would be one of our first areas that we want to see as a home visitor. They allow us and they extend that invite and see, this is where my child sleeps or where I sleep. And we work closely with the family or with the patient to make sure that we educate them on what might be provoking an exacerbation at night, why he's waking up at night, etc. Next slide, please. Is that my final slide? Okay. Just continuing on I'm looking at my slides on my end. And home visitation education, really at the end, we want to make sure the patient is able to demonstrate correct technique when using his inhaler. The patient is understanding the difference between, as I mentioned, the rescue medication and the controller medication. They will have more concrete understanding of the action plan, and if they have received a peak flow meter, making sure that they know their numbers and how those numbers are there on the action plan. And it's really just sitting down and really explaining and having that patient, that family understand the condition. Again, triggers in the home, how to reduce and avoid. And again, I mentioned this is with our environmental walkthrough assessment. usually takes about 30 minutes, sometimes 40 minutes, depending on the home and the questions that the patient has during our walkthrough. Reducing asthma triggers and resources for us, reducing the asthma triggers is crucial, especially in Imperial County. We see a lot of that unhealthy products that they buy, the bleach, the Fabuloso, the mixing of ammonia, and while they're cleaning their tub with Ajax. So we cover these very important points throughout the course of our visits, either visit 1, 2, or 3. And we also help them with pest management. And again, really having them understand where do they live, what are the factors, is it air pollution, are they living near close of a field that is, burning several times a year, are they spraying pesticides? We make sure that we connect them with how to receive alerts and reduce exposure, and working very closely with encourage them to reach out to their schools, reach out to their students, guardians throughout the course of the day. So, I mean, as you can hear, it is really an array of information and education and empowerment that we provide to patients, to individuals. And at the same time, all this is happening, we do have a patient database that we created here at UCB, where we're able to report back, and funders are able to see our statistics. Obviously HIPAA guidelines are very confidential, and they're able to see the numbers. How many visits do we have? How many clients have we seen in the past week, in the past month, and how that is working. I think I'm going to start there because I do see funding and sustainability. But I wanted to just give a moment to Luis. Do you want to just talk quickly? I know, how many minutes do we have, Arden, so we can talk about funding, if anybody had questions on that at the end.
You have about 5 minutes left, a little less than that.
Okay.
Just a couple of thoughts on funding. Funding it can represent many things. I understand that there's a lot of hope and effort that there will be some mechanisms for reimbursement. We're actually working on another program that is doing a cost-benefit analysis. We're still pretty early on that, and the reason for that is because it requires a lot of heavy lifting and integrating a decentralized method of bringing in an external organization into a healthcare institution, and then being able to have a linkage of the patient from the medical provider to the home, back to the medical provider, in a closely monitored, managed way. At the same time, being able to determine sort of the cost benefit of that. We don't have those results yet. Our hope is that the program does prove that it is feasible to have a linkage managed program. We are not at the point where we're yet getting those numbers to understand whether that's going to be a sellable program that health plans would subscribe to. The program that we're working right now currently in Calexico, that is a program that is fully funded by Heffernan. Their focal area is the city of Calexico. The difference is that we see it as more as a proactive program, reaching out to families who have been identified to have asthma, or whether it's diagnosed or undiagnosed, and being able to provide them the entire benefit of the home education and everything that Esther just explained. That for us is sort of a traditional. It is a soft money, so it's just contingent and dependent on the funder. We know that that there's a lot of different programs right now that provide incentives. We have some conversations that we're having with private medical providers who are seeing opportunities where they bring in these programs, these healthy home programs, and other measures that they need to meet in order to get incentive dollars. through the health plans. So I would say that in terms of funding and sustainability for us, we're still trying to figure out what's that hard money going to be like, or what's that system going to look like for us to be able to tap into the health plans and be able to get reimbursement. We find value, obviously, in our programs, but the other thing to consider also is that even if you have a system that functions within the healthcare, there's still a large segment of the population that may not be captured through a centralized linkage program, and that's what we're finding in Calexico. The benefit of having this information reaches the masses versus waiting for somebody to have a asthma trigger or asthma attack or an emergency department visit and then catching them, more of a reactive versus a proactive. So there's a cost value to that. The way we've been able to sustain it is the way we've always sustained most of our programs, is leveraging our different programs. In other words, we have programs that have to do with air monitoring and air notification programs. Some know it as a school notification program, and then being able to bring an asthma. Well, sometimes we're able to bring different programs together and being able to sustain staff to get them to 100%, full time and so on. But if you have more specific questions, in terms of measures of programs, Esther just mentioned the database that we created a few years ago that we utilize to capture data and able to measure our progress real time. We can talk a little bit about that. But I'll take a pause and see if there's questions on funding and sustainability.
And I'll take it back for a few minutes. Arden, do I have about 1 minute, 2 minutes? I'm sorry, I'm not, since we started a little bit early, I'm not keeping track of my time here.
We do need to move on. So if you guys have maybe a minute more, we can do that, but we should move on soon.
Okay, let's move on.
And we do have
thank you.
Okay. And we have a Q&A at the end. So if you guys do have questions, you can always type it into the chat box and we will respond to those at the end. So thank you, Esther, and thank you, Luis. We are excited to hear about, thank you so much for your information and expertise from a community-based organization perspective. So we are going to move right along. We'll hear from Carmen and Mauricio from Inland Empire Health Plan, and they are going to give us their information and expertise from the point of view of a health plan. So welcome, you guys, and thank you for being on the webinar.
Thank you, Arden.
Thank you.
Hi, everybody. As Arden stated, my name is Carmen Ramirez. I'm the Health Navigator Manager here at IEHP. And just to give you a little background, the Health Navigator program, we are community health workers, and we have been with the health plan for the last 10 years. With IEHP, it is a Medi-Cal health plan, and we service both San Bernardino County and Riverside County with about 2.1 million members. And of course, with my health navigators, I have 9 health navigators, 2 supervisors, 1 coordinator, and myself. We definitely cannot visit all 2.1 million of our members, so there are certain criteria that our members have to meet in order for us to be able to home visit them out in their homes. Am I navigating the PowerPoint, or is that you, Ashley, or Arden? Thank you.
Ashley, yeah.
Thank you. So just to give you a little bit of our goals as a community health worker here at IEHP, our goals really are to reduce unnecessary ER visits. And that's really by educating our families in the home with making sure that they understand the difference between when they would go to the emergency room, when they would go to the urgent care, or when they would go see their actual primary care physician. We want to make sure our members are well educated so they know exactly how to utilize the emergency room when it's appropriate. And we also are wanting to link members to non-IEHP resources. So one of the biggest things that we're learning as a health plan is that in order for someone to manage, for example, their asthma, their chronic condition of asthma, we need to make sure we're also managing any social determinant needs they may have. So any social needs such as they don't have food, or maybe they don't have the money to buy the right products, or their living conditions, where they're living, environmental conditions. We look at the whole aspect once we're in the home, and we make sure to link our IEHP members to different community-based resources in order for them to be able to get what they need socially. We also help, again, with basic social needs such as making sure that they can keep the lights on or how to pay rent. So my community health workers, when they work out in the field, they're also working with different community-based organizations. And we have about over 2,500 plus partners that work with IEHP to help link our members. That way, our members, our goal, again, is to making sure once we link them to meet their social needs, now our members can be less stressed about those social needs, and then they can now focus on their chronic conditions such as asthma and making sure to manage that appropriately. Another thing that we want to do in the home is we want to increase child immunization compliance. A lot of our members that our my community health workers work with, we notice because we're a health plan, the beauty of the health plan is that we're able to actually see data. We have a team internally that all they do all day is look at data. So we're able to see which of our 2.1 million members are behind in immunizations, where they're at with where they were diagnosed with asthma, whether it's the ER, the urgent care, or their primary care physician, what level of asthma they're at, did they just get diagnosed, or are they chronic, or it's turning into now at COPD. So we want to make sure we're connecting them and making sure they're going to their doctor's appointments on a regular basis to prevent more of a chronic condition. We're also linking members back to resources internally here. So, for example, once we're in the home, we are educating them to connect back to the health plan, or we're signing them up ourselves to making sure they're going to their the asthma education classes that we offer at our community resources that we have our health educators go out and provide. And we're also making sure that they're connected back to the health plan in case they need a second humidifier, or they need a peak flow meter. A lot of our members are fundamentally confused on what exactly the health plan covers for them. If they have IEHP, we help them navigate their benefits. So we want to make sure that if it has anything that's related to asthma and or anything else, we're making sure that they're navigating the healthcare system appropriately and connecting them back internally to the health plan and making sure that they're getting both their needs met with any other chronic conditions they may have, or any other reasons. Even if they wanted to change their primary care physician, we help them do that. One of the other things that we like to do in the homes is link members, like I said, connect to their primary care physician. One of the things that we, especially with our asthmatics, if they need to go see a specialist, we want to make sure to connect them to their specialist and that they have transportation. If that's an issue, we make sure that they get transportation to get to their specialist to see where they're at with their condition. So those are just some of the goals that we have in the home when we're working with our families. Next slide, please. So the social CHW role here at IEHP, our priority is providing person-centered services, completion of a health appraisal, which is our assessment that we ask various questions on. We also, any community health worker on my team, they're mandated to close 15 cases a month. I know that was one of the questions that someone had asked. And when I say case manage, they can be case managing anywhere minimally 15 a month to more. It just depends on the need of the family. We do utilize motivational interviewing skills in the home, and we address members' medical and health as well as social needs depending on level of need. It can be face-to-face visits in the community resource centers and or the members' homes. It could also be phone calls, and we do conduct phone calls 6 months after my health navigator closes a case, and we connect with them. We will be connecting them with, again, 12 months later. We connect members to community resource centers for health, wellness, and fitness classes to make sure that we're providing whole person care. One of the biggest things that we're finding out in the field is that we do come across a lot of individuals that are homeless. And what we do is we connect them right back to either our housing initiative internally that we have to get them housed, And again, we work with a lot of our partners that we have in the community to make sure that we're linking our members, should they be homeless, making sure that we're providing them with shelters and or vouchers to get them the housing that they need, transportation, food, and we're utilizing Connect.ie a lot. If you haven't heard about Connect.ie, it's a website, connectie.org. Please check it out. And we're connecting members to various internal departments, as I stated, such as behavioral health, case management. If a member has so many things going on, we want to make sure they're managed with nurses and or doctors in-house to make sure their care is taken care of. Again, we're providing access to care education, which is emergency room, urgent care, nurse advice line, providing postpartum education, asthma being a big one, as well as immunization. The way we measure success internally is a big deal for us. We measure success using metrics that are dependent on meeting medical, behavioral health, social, emotional, and program process outcomes. The metrics that are gauged as follows: closing care gaps in primary care and recommended screening, such as breast cancer, cervical cancer, flu shots, smoking, self-reported social need fulfillment, self-reported goal attainment, number of assessments completed by the community health worker, number of home visits completed by the community health worker, as well as member engagement at our community resource centers. And then, of course, social determinants of need, depending on how many referrals we are linking our members to. One of the things that we're also doing in making sure that we're reaching the community at large is we've partnered up with the San Bernardino Unified City School District, where we've been there for about 3.5 years at 4 schools, and we've been able to outreach to over 800 students and families who've been visited by a community health worker. And that was with 4 schools. We provide parent engagement, which has also extended to phone education, as well as the one-on-one face-to-face out in their home. Being with the school district and the success that we've had in 4 schools, we have now expanded to 10 schools in San Bernardino with a total of about 6,500 students combined. And my health navigators will be designated to 2 schools each, in which they will provide everything that they already do now, but they'll be working strictly with the students at those schools. We have run a report where our data team has given us input where 95% of the students on those campuses that we will be at have IEHP. So essentially, their students are our members that we would already be working with anyway. So we are getting ready to kick that off on September 3rd to be on more campuses. So that's exciting for us. And again, we'll be making sure asthma education is done and making sure that we're also connecting them to the other partners that will also be on site. Kaiser being one, as well, providing asthma mobile education, having a mobile come to the schools to provide them the education that they need and or screenings. Another thing that we have is I have a community health worker at an apartment complex in Riverside County. It's Rubidoux Manor, and it's a low-income apartment complex for senior citizens, and I do have a health navigator there who is stationed there 3 days a week, Mondays, Wednesdays, and Fridays. What she does is she provides one-on-one with residents in reviewing their benefits and in connecting to various base organizations when needed. We're making sure, again, connecting them to case management, behavioral health, housing, our health homes collaboration. That's a big deal in health plans now, is providing an actual CHW to our most chronic members, which in terms means they're our highest utilizers. So what we did here, we have a housing initiative internally. So I know one of the questions that was asked was about homeless individuals. When we identify someone that's homeless who has IEHP and is a high utilizer, meaning they have a chronic condition and they are constantly going to the ER, we pretty much pay for their rent. So we bring them in, we pay for their rent, we stabilize them, and we connect them to a community health worker to make sure that they're medically, they're going to all their appointments. And or what we learned as a health plan is if we pay their rent, it's a lot cheaper for us in return for return of investment and making sure they're stabilized instead of them constantly being homeless and going and returning to the ER. and being hospitalized. So that's why we have a community health worker on site at Rubidoux Manor. Next slide, please. Here's a quick snapshot of some of the data that we have. We do have an internal database that we use, and we track every single encounter that we come across. And as you see here, this is just from November, based on some of the programs that I have discussed already. And as you can see, we do track language, gender identity. We do provide, we do an assessment pre and post on the PROMIS scale. We also ask the questions, think about the place you live in. Do you have any problems with any of the following? And we track that. For example, as you can see, pests, bugs, and that's for us to know what kind of education we need to provide in the homes. So and this is only some of the data that we have. We do collect a lot just because we want to make sure for our return of investment, I can share this information to my upper management and making sure that they understand the beauty of having a community health worker with a health plan. Next slide, please. Again, some outcome data, total assessments we've completed, community resources and referrals, behavioral health concerns that we've addressed, health education referrals, and appointments scheduled. This is just a snapshot. So again, for us, data is very crucial, and that's why we're constantly making sure that we're capturing as much as possible. Now, I have 10 years worth of data, but again, like I said, this is only a snapshot just so I can showcase exactly what it is and why it's so important for us to capture the data that we do. One of the biggest things as community health workers is safety. And I'm going to turn this over to Mauricio actually in a little bit, but I just want to give a snapshot in regards to the safety for my team. We work very diligently in making sure that we're constantly very transparent. Communication is very vital for my team because 85% of the time they are out in the field working in the homes of our members. And or just out in the community. So transparency with their Outlook calendar is crucial. So all of my team is consistently going through training and making sure that they're updating their calendars with all the information that we need. They are color-coded, so I can do a quick look to making sure that they're out in the field and where. One of the things that we also do is make sure all of their technology is charged. They are equipped with their iPhones and iPads when they're working with our members. We do have a tracking device on all of those devices, but not to micromanage. That's just for safety reasons, so we know where they're at. We coach and train on the importance of making sure their purses and their wallets, make sure all the valuables are not visible when they're out in the field. They know where they're going ahead of time by setting up their Google Maps for location. They check their vehicle before heading out. So making sure they're always, prepared, essentially. So, Mauricio, do you want to chime in really quick on just your experience being out in the home? We have about 2 minutes.
No, for sure. So a little bit of safety for field staff, personally, that I know going into homes is I definitely try to arrive early, enough time to drive around a little bit around the neighborhood, kind of get familiarized, make sure that my car is as close to the house or apartments as possible. I also try to park where if I have to leave right away, I don't have to back up. If it's a cul-de-sac, I can just, reverse park and leave right away. I definitely, when I walk in the home, do a quick scan, know where my exits are in case I do need to leave. Obviously, go with your gut if, you don't feel comfortable, or if you just arrive and you don't feel comfortable, definitely don't go in. Go with your instincts for sure. Let management, even let your other CHWs know. Personally, I've had to email my management, but also text my CHWs, kind of letting them know, hey, I'm at this house. My appointment is about an hour. If you don't hear from me, please call me. Remain calm and confident is definitely a big thing. You don't want to appear that you're nervous if, you are in a sketchy area, but always be respectful because sometimes our families that we do service, they may not live in the best of areas, but we don't want to make them feel like that. Be aware of animals. So you definitely want to be aware of large animals, and there's nothing wrong with letting the families know ahead of time. I'll be arriving at this time. If you do have any large animals or even small animals, if you can, just keep them locked, and they're usually very, very good with that. And it's always okay to say no. So if, you don't feel comfortable for any reason and you have to just leave and it's an emergency, just leave your stuff if you have to, and then just make sure you get out of there safe.
Perfect. Next slide, please. I think we have just one more. Some of the ongoing safety training that we do is ongoing team meeting safety tips. So we always cover safety in our team meetings. Twice a year, we have the police department come out and they train my team, making sure, and that can consist of, we also do a self-defense course every year, and that's a non-tactical self-defense. And then again, as I stated, communication is vital, always emphasizing that with my team, how important it is for our entire team to be on the same page through communication with transparency. And I believe that is it.
All right, thank you so much, Carmen and Mauricio. It was nice to hear from the perspective of a health plan as well. We're going to do a little bit of webinar gymnastics. Ashley, can we go all the way back to the beginning? So now we have Opulence and Nasira. These are two people from St. John's Clinic. So we will hear about the community health program that they have at a clinic in South LA. So St. John's has been in South LA for decades. And they provide in-home case management and education and comprehensive housing assessments. We did hear from all of these programs earlier in the webinar series. Specifically with St. John's, we heard about their Healthy Homes program when they partner with Esperanza and Sage. They have a lot of good partnerships. So welcome, Nasira and Opulence. We're excited to hear from you.
Hi, thank you all for having us. We are very excited to be sharing about our program.
Hi, I am Nasira Torres, Healthy Home, Healthy Kids asthma program project care promoter. I provide asthma health education to patients regarding about asthma for St. John between 0 to 18 years old patients. I obtain the patient referral from doctors, emergency rooms, list from retention team or from insurance company. I took for the patient from ECW and verified the eligibility is not eligible. I would refer the patient to Esperanza Community Housing.
Yeah, so just to speak on that a little bit, so we do receive reports because we're a community health center with 16 locations. If any of our patients have gone to the ER, their insurance company will send us a report letting us know that they've been to the ER. Our retention team will schedule a follow-up visit with them. And we also receive, by we I mean my team, me and Nasira, we receive the reports weekly and go through them to see if there's anyone under 18 who had an emergency room visit due to asthma. On the reports, they don't say asthma. It'll say wheezing, coughing, shortness of breath. So anytime we see that, because our program is targeting children or families, anytime we see anyone under 18 with any of those symptoms, Nasira will reach out to the family or even try and reach out to the doctor and join their medical visit to enroll them in services. We also receive a list from insurance companies, and our doctors can make internal referrals. So that's kind of the different ways we find our patients. Our electronic health record is called ECW. So we always document in there to ensure that we are keeping doctors up to date.
Well, I conduct 2 home visits in 6 months and 1 phone call follow-up in 3 months. I enroll around 10 patients per a month. When I get the referral, I call the patient and make an appointment. When they are available to receive the home visit, I introduce about the asthma program for St. John's Well Child and Family Center. And my first home visit, the family is educated about asthma. I have a profile and explain step by step what happened with asthma, asthma signs, asthma symptoms, asthma medication, and what they do, how to give the asthma medication, and how to use the spacer correctly. Describe what to do an asthma emergency and explain the action plan based on the traffic light concept, green, yellow, and red. I have a little sample that I have to show the family. And I explain how to use the P-Flow daily to reduce the asthma symptoms. help you identify when the trigger major asthma symptoms, work on how to clean with non-toxic cleaning supplies. The asthma program provides a free bucket and non-toxic supplies plus mattress cover and pillow cover. I get the supply for RTN and organizations. Yeah. How to identify the asthma attack and explain about the medication, what kind to take it, and how to use the spaces. And then I talk about the trigger and environment control and explain about allergens and irritants. I give example of kind of like animal danders, pollen, dust mites, pests, roach, bedbugs, and more. Irritant, strong odors, and chemicals. After the class with the family, I ask for permission to check out the house and identify the trigger, like the house have any problem with plumbing, with smoke, like water, leaking water, if they have a smoke detector. Adaptation, if they have a smoke, if they use a strong product to clean the house, and explain how to use the non-toxic products to clean the house. Like baking soda, vinegar, peroxide, argon gel, bottle soap, show them supply that each family receives, and it's free bucket supply from the asthma program provided for St. John's Well Child and Family Center.
Yeah, so our program is currently grant funded. Like another panelist, we also have health homes, so we're going to be transitioning our funding source into that, and we're going to specifically target families with asthma. So that's a really exciting piece of the funding. Right now, though, to get the program supplies covered, that is all grant funded. And so we worked with an external evaluator, and we used the ACT, the Core Caregiver Survey, and the Home Environmental Checklist. NACIDA administers that at intake, and then at 3 months over the phone, NACIDA re-administers the Core Caregiver Survey and the asthma control test, and at 6 months, NACIDA re-administers all 3 surveys again. We're tracking all of that information in our electronic health record. We also work closely with Esperanza and another one of our partner agencies, SAGE, so that we are able to look at health outcomes and see how it links to the intervention.
Yeah. This program has helped a lot to our community, offer a lot of tools and education for our patients, and educate patients regarding the asthma program. If this program didn't exist, we will have more kids sick and without medication, how to control asthma.
Is there anything else, Sarah? Yeah. So that is basically our program. The slide just shows the different supplies that NACIDA offers the families when she does the first visits, and let us know if you have any questions.
Yeah.
Thank y'all.
Great. Thank you. Thank you so much, Opulence and NACIDA. We do have a little bit of time for questions. If you have any questions, you can type them into the chat box to all participants. But while we wait for that, we do have a couple questions that came up earlier during the registration process. So I will ask it, and it goes to all 3 presenters. So you guys can just jump in and answer. And I'll combine a couple for the first one. So do you assign...
Hey.
Yes.
There was actually a question during Esther's presentation that was sent to me. Can I go ahead and ask that before we start with the registration questions?
Oh, yeah. Yeah, please do.
Just so that we can address people's questions. Esther, during your presentation, someone asked for you to define the triggers in the home. Could you talk about that for a second? Hi, Esther. We can hear you. Hi. Hello? Hi, Esther?
Hello?
Hi, Esther. There you are.
Oh, hi.
Hi.
Yes, I think some of our presenters answered some of them as well. But yes, so I mean, it can be from we're talking about indoor, but we also focus a lot about the triggers outdoor, which might be, the smoke, the burning. Inside the house, it might be the dust, the pest, the mold that somebody shared. Do they have any water leaks? Do they have anything in the restroom? They have maybe no ventilation. Do they have any pest? Also really finding out if they're really allergic to pet dander, because we don't want them to say, we don't want to say you need to get rid of your dog. We just want to make sure that they know that that is a trigger for them or not. And odors and sprays, and what products are they using? I know that our presenter also talked about the green cleaning bucket. We really emphasize on that, on cleaning healthy, especially our Hispanic population. They really like to pour without really, realizing that it's unhealthy, not only to themselves, but the environment. And so making sure that they're, vacuuming weekly. And so we give them ways to reduce and avoid these triggers. And so I hope that answers that question.
Thank you, Esther. That was great. Arden, sorry for the interruption. We can go to the registration questions. Thanks.
Great. And thank you, Esther, and thanks for the question. So we'll combine a couple of them. We have about 5 minutes left. So can you guys speak to, do you assign a certain number of patients to each community health worker or promotora? And then how often do you check back in with your clients or patients, either by phone or with a home visit?
Hi, this is Carmen from IEHP. For my community health workers, they work in territories. So, and especially now since they'll be going in the schools, they get their referrals from the school. So the principal, the vice principal, the nurse, the psychologist, they refer over the students and the families over to my community health workers. So my community health worker, they're mandated to close a minimum of 15 cases a month. So they can take on more than that, but the quality of service is what is important to us as well. So they take on those cases from the schools because that's how they're referred. My other community health workers, our plan, my IEHP, our data team would send over. These are of the 2.1 million members. This is who you need to see because they're constantly going to the ER. Or they're behind in their immunizations, and that's how we received our referrals. And again, they were mandated to close 15 cases a month with that. And I don't know, there was a second part to that question that I can't remember, Arden, to be honest.
And how often do you check back in with your clients or patients?
Thank you. And that's a check-in. Right now, we're checking in. They're case managing them, so they can follow up with the member as many times as they want until we've met the needs of that member and or family. But I do have a specialist on the team that conducts phone education and or phone follow-up 6 months, every 6 months, and 12 months as well.
Great, thank you. All right, I believe that St. John's answered that question, and I also think that CCV answered that question during their presentation. So Ashley has a couple questions that were asked during the webinar, so I will hand over the Q&A to her for the last couple minutes.
Fantastic. Thank you, Arden. This is specifically for Inland Empire Health Plan. I got a couple questions saying, how do you get members to enroll in your program, and do your community health workers work directly for you, or are they contracted? Those are two questions for you. Sorry.
So for the first question is, how do we get our members to be a part of it? Our program, the community health worker program, is voluntary. So they do cold calls. They call the member themselves, and they let them know, I'm IEHP. I'm the health navigator for your area. I noticed little Johnny's behind on his immunizations. May I please come into your home to educate you on the benefits of having IEHP? So it's almost like they have to sell the program over the phone. Now, my community health workers that work on the school campuses, they have the luxury of actually meeting the families face-to-face, and the parent says, yes, please help me navigate the healthcare system. And that's how they enroll. So we never force our members to be a part of the program. It's always voluntary. And in regards to my community health workers, they are workers, they work for IEHP. We do not contract. They are fully salaried and benefit community health workers. And that's something that our CEO saw very beneficial of having community health workers. And that's why we started off as an idea 10 years ago, and it's worked, and here we are 10 years later. Did that answer that question?
Yes, thank you. That's all the questions on my end. Arden, I think you can close it out.
Great, that sounds good. It is 12 on the dot, so that is the end of our webinar. Thank you, everyone, for attending. Actually, if you go to the next slide, we do have some contact information. So if you have any questions, feel free to contact either Esperanza, Arden, which is me at Esperanza, or any of the presenters that we had today. And we will get back to you as soon as possible. And then if you go one more slide, Ashley, there should be the link. So the Asthma Management Academy has a YouTube channel that has the recordings for all of these webinars. So we've done 6 this year. This is the 6th of 6. So all of them will be online. So you can use that link to go online. Thank you, everyone, for attending, and thank you so much to our presenters. We really appreciate your time and your expertise and knowledge. I have learned a lot about the differences in the community health worker and promotora models that are in different types of organizations. So thank you again, everyone, and have a great week.
Thank you.